Birth is natural. It comes at the end of pregnancy, and 100% of pregnant women will give birth one way or another. And there's no way to know what our birth is going to be like, which means we don't know if we're going to have a long labor or short labor. We don't know if we're going to have a pain-free labor or one that makes us feel we're going to die. The one thing I really want to tell you is we learned we did have to practice them. We couldn't rub this content on our skin or just go, oh, sure, I know. If you do not know how to use skills, you won't use them, because birth is very challenging, both in terms of the internal sensation, the external factors around us. So there's a handout on practice. There's a handout on how to stay in the now so you're not future tripping. You want to use your skills right now. And we have a great handbook about the progression of labor, which teaches us how to read the messages our baby gives us. If our contractions have a bell-shaped curve, they start, they go up, they peak, they come down, they go away, our baby is telling us that there is no internal tension, we have not bent its space, and we have not compressed the container it's in. If the contractions start to go up and then plateau off, then go away, the baby is telling us either it doesn't like our position or posture, we have too much internal tension, we are bending its space, or we are compressing the space. However, often women are told to get into positions they like, which means that they often get into positions which back off the labor, which make it unprogressive, and they stay in labor for hours and end up with more medical assessments, monitoring procedures. So there is an audio on this as well that explains that birth is not a noun. It is a verb. You have to do it. It is an activity you are doing. And one of the most important skills that we learn are breaking up contractions into 5 phases. Because if not, we ended up saying this. Contractions were easy, then they got harder, then they got too hard, then I didn't cope with them. And we took contraction as a one thing that we had no control over. When we broke it up into 5 phases, it started, it went up, it peaked, it went down, it went away. We could use skills in one or more of those phases, sometimes not in the peak, but that lasted for a short period of time. And the person who was with us, our partner or other, was able to help us use those skills. They never had to stop helping us.